Thank you, and thank you very much for welcoming us back to the University of East London, which, as we've heard, has got a very strong story of its own to tell. There's a story being told about our country, a story being repeated so often it risks becoming accepted as truth, that politics no longer works, that government cannot deliver, that public institutions are in permanent decline, and that the big challenges of our time are beyond our power to solve. And from that story comes something that is even more corrosive, a quiet, creeping cynicism, a loss of faith, not just in politicians, but in the very idea that collective action can improve our lives. This is a dangerous place for our country to be in, a dangerous place for any democracy to be in. Because when we stop believing that change is possible, we stop demanding it. When we stop demanding it, we stop achieving it. And when that happens, decline doesn't just continue, it accelerates. It is the biggest fear I have as a member of this government, that cynicism might give way to fatalism and a sense of the inevitability of decline. The NHS stands as the greatest expression of our country's values and the virtue of collective action. An institution born out of a simple but radical conviction that the people of our country should receive the care they need, not just the care they can afford. A powerful promise founded on fairness, that whoever you are, whatever your background, whatever your income, when you fall ill, you will never have to worry about the bill. It is with this in mind that I have felt a particular responsibility resting on my shoulders as our country's Health and Social Care Secretary. Not just the responsibility to rebuild the greatest institution this country has ever built, but to give this country a sense of hope, optimism, and confidence based on experience. Because in today's day and age, the only change we can believe in is the change we experience. I stand here today, just 20 months into this job, as the longest serving of the last 5 Secretaries of State for Health, 6 if you count Steve Barclay twice. And I am able to say something that none of my Conservative predecessors could say at the end of their time in office. The NHS is in a better state today than I found it, and I'm just getting started. For the first time in 15 years, waiting lists are falling, down by 374,000 since Labour came to power, and the lowest for around 3 years. We achieved the best 4-hour waiting times in A&E for 4 years this winter. Ambulance response times for suspected heart attack and stroke victims are the best they've been for half a decade. Patient satisfaction with access to general practice has risen from around 60% when Labour came to office to around 77% today. Staff retention is the best we've seen at any point during the last decade outside of the pandemic. We're also keeping our promises. We promised an extra 1,000 GPs in our first year. We delivered an extra 2,000. We said we would recruit an extra 8,500 mental health staff over 5 years. We've nearly hit that number already, and over 900,000 more children and young people now have access to an NHS-funded mental health support team in schools. We said we'd deliver 700,000 more NHS dentistry appointments. We delivered an extra 1.8 million appointments in the first half of this year. We're passing 3 bills into law, reforming the Mental Health Act, creating the first smoke-free generation, and prioritising UK graduates for medical training places. And as well as investing an additional £26 billion into the NHS, we're investing an extra £4.6 billion into social care by the end of this Parliament. The first ever fair pay agreement for care workers backed by £500 million, and the biggest expansion of carers allowance since the 1970s. People are beginning to feel that change. Today's British Social Attitudes Survey shows a 6 percentage point increase in satisfaction and an 8 percentage point decrease in dissatisfaction, the biggest fall since New Labour in 1998. Dissatisfaction with social care has also fallen by 4 percentage points, and we've achieved all of this at the same time as confronting higher levels of demand, industrial action by resident doctors, and the perennial challenge of what Harold Macmillan once described as events, dear boy, events. We've done so at the same time as living within our means. In opposition, I criticised the begging bowl culture that led to poor financial grip because of the working assumption, based on experience, that the Treasury would always cough up more because it's for the NHS. Well, this is the first year in almost a decade where we haven't asked the Chancellor for more. We're also demonstrating to the Chancellor and to you, the public, that we're spending your taxes more wisely. Yes, we're making good use of the additional £26 billion, but we're also making all of the money we receive go further. Our productivity target was 2%. We delivered 2.7%. And all of this taken together, the improvement in performance, the rise in patient satisfaction, our better use of taxpayers' money, are grounds for optimism, but not cause for complacency. When I'm on the telly or radio, as I was this morning, or increasingly recording clips for socials with real, evidenced, tangible proof of improvement, like falling waiting lists, I can almost hear millions of people shouting at the telly. And I dare to read the comments and mentions, crying, in the polite cases, what are you on about? But two things are true at the same time. The NHS is improving, but it's still nowhere near good enough. Take Queen's Hospital in Romford, not far from here, as seen on TV, because when hospital corridors were full of trolleys this winter, the broadcasters, understandably, chose the hospital of the Health Secretary to exemplify the national crisis. Last Friday, I was back there, no cameras in sight, aside from my own. I walked the same corridors I did in January, but this time the corridors were empty. And no, not because they'd been pushed into the car park, as one wag on social media suggested. And anyone who knows Queen's Hospital knows it's hard enough to get a parking space in the multi-storey car park, let alone fill it with trolleys. The truth is that the Trust leadership, with their clinical teams, changed their model of care. They put a senior consultant on the front door of the A&E to make swift triaging decisions, sending frail elderly people who needed care, but not A&E, into the Frailty Same-Day Emergency Care Centre. They worked with the London Ambulance Service and community teams to get people the right care at home. And as a result, 12-hour waits were down, 10,000 corridor hours were saved in February alone, and the corridors were empty, aside from one chap who was about to be wheeled in for a scan. Now that is amazing progress, a real credit to the staff at Queen's, and it is absolutely no comfort to a friend of mine who sent me a picture of her 86-year-old dad on a bed, in a corridor, by a vending machine on the other side of the country, suffering with Parkinson's, a small bleed on the brain, with no water, no buzzer, and no dignity. Glad to see this can be done, said my friend, seeing the images I'd posted from Queen's. I had the opposite experience with my dad this weekend, and how that image of Mike is etched in my mind as I recount that story now. And it is in that context that I address you today, not just as the politician responsible for leading our NHS and social care services, but as a person who feels an obligation to my family and friends and to yours to get this right. Proud of our progress, but honest about where we continue to fall short, often ashamed when confronted with the reality of an NHS that still isn't there for people when they need it every time. I'm asking you to do just about the most radical thing that anyone can do in Britain today. To believe again. To believe that the NHS can be better than today. To believe that the NHS will be better than today. Not through the triumph of hope over experience, but hope built on experience. Because the NHS today is better than it was when we came to power. And it will be better in the coming years because of the choices we are making and a plan that is working. Let me explain how and why I believe that to be true. I said on day one that the NHS was broken, because it was. And if the NHS was our national religion, then it needed a reformation, not more devotion. I walked into the Department of Health and Social Care with a clear plan, not just a bold statement. That started with Lord Darcy's investigation, because you can't prescribe the treatment until you have an accurate diagnosis. He left us with a stark but simple choice. Do nothing and leave the NHS to die, or modernise it to make it fit for the future. Based on that diagnostic, we wrote our prescription, our 10-year plan for health, built on hundreds of thousands of contributions from the public, patients, and professionals. It set out the radical transformation required to rebuild our NHS. 3 big shifts in provision of healthcare, from hospital to community, from analogue to digital, from sickness to prevention, and major reforms in how the NHS is run, removing unnecessary layers of bureaucracy, ending the culture of micromanagement, and directing resources and responsibility down to the front line. The progress we've made wasn't by accident or by chance, or because the NHS has a natural predisposition towards self-improvement. The lesson of Labour's success after 1997 and post-2024 is that it's investment and modernisation that delivers results. Take waiting lists. Yes, we've invested. We're delivering record levels of activity to bring them down. But we're also modernising by expanding access to care, with more appointments in the evenings and at weekends through community diagnostic centres, getting patients seen sooner and their tests and scans done quicker at times and places that suit them. We sent crack teams of top clinicians to hospitals around the country where the highest numbers of people are off work, sick, to help them cut waiting lists faster, using high-intensity theatre lists that run like Formula One pit stops, getting more patients through and more bang for the buck at the same time, getting people not just back to health, but back to work. Hundreds of thousands more patients have avoided waiting lists altogether, thanks to support from GPs to get advice from specialist services instead, like dietitians, physios, and sexual health experts, making sure patients get the right care in the right place at the right time. Sometimes it's not about money or process, it's about mindset. Under our predecessors, there was an acceptance that when doctors go on strike, planned operations just get cancelled, as if these were pain-free, consequence-free cancellations for patients. We didn't accept that, and we made the safety case for maintaining planned care, keeping 95% of activity going even during strikes. We also promised to make it easier to get a GP appointment, and it is. We're ending the 8 a.m. scramble by opening up online access during core hours so that patients can reach their GP more quickly and conveniently. More flexible funding meant we could stem GP unemployment, recruit thousands more, and in fact we now have the highest number of GPs on record. And more clinicians mean more appointments and shorter waits. By cutting unnecessary targets for GPs, we've also freed them up to spend less time on paperwork and more time with patients. No wonder patient satisfaction with GPs has risen. We also said we would bring accountability, and we have. We published new NHS league tables, not to name and shame, but to confront the challenges we all face with grown-up honesty. We've also started phasing out the multi-billion-pound bailout fund that created a culture of rewards for financial failure. We wasted no time in exposing the serious failure at the Care Quality Commission and turning it around so that it can ensure that care is safe and consistently high quality. Finally, we said we would reward those who deliver, and we are. Great leadership has a direct impact on patient outcomes. That's why I approved higher salaries for NHS leaders, knowing full well the brickbat needs are filled in the press. But bonuses for NHS leaders are now tied to performance, so that success means better care for patients, not just better results on paper. We're paying more to those prepared to go in and sort out the worst performing hospitals, because the quality of care you get shouldn't depend on where you live. And we've done all this at the same time as embarking on a major transformation in integrated care boards and NHS England. We're in the final stages of the biggest transformation programme in the history of the public sector. And I realise, by the way, that it's been a really hard ask of leaders and dedicated staff who faced uncertain futures. I know they've not thanked me for the decisions I've taken, and the impact of people and their families is not lost on me. But there's no way that I could justify employing two teams, doing the same job, sitting a mile apart from each other when we don't have enough GPs. Abolishing NHS England, slashing bureaucracy, and reducing headcount in Whitehall to the size it was in 2010 is also freeing up more than £1 billion a year to boost frontline services. It's been difficult and painful, but it's been absolutely necessary too. And to those who say the public sector should be more like the private sector, I'd just like to point out that hospital productivity is growing faster than the private sector, so maybe it should be the other way around. This is a system that is rebuilding trust in our ability to deliver. If we hadn't made these choices, the NHS would be flailing and failing. Instead, investment and modernisation are paying off, and with it, ambition and optimism are returning. Which brings me to an uncomfortable truth about our progress so far. Right now, a cluster of high-performing trusts are masking some chronic underperformance in other parts of the country. Failure has been tolerated for too long. Staff know it, patients feel it, and I won't stand for it. We won't have succeeded in changing the NHS until we change it for the patients who are suffering the worst services in the country. In some cases, so many years of poor service without improvement is feeding that sense of fatalism. They believe that after so long, it just can't get better. In fact, in many cases, they have never seen it get better. That's why I'm announcing today a new intensive recovery programme. This will target the worst performing providers, sending in our best leaders, and where necessary, delivering the structural changes needed to get them back on track. No more turning a blind eye to failure, even if it means taking the most radical route of breaking up the trust. Stepping in like this sends a clear message that Labour will do whatever it takes to restore basic standards in the NHS. But in 2026, the public rightly expects more than just the basics. One of the great challenges of our age is how to reform the state and public services to meet people's rising expectations and demands. The command and control playbook used by New Labour was and remains effective in tackling poor performance and moving from bad to good. But what it won't do is get the NHS from good to great. Only power to the patient and freedom to the front line will build the kind of dynamic, high-performing, high-impact NHS fit for the future that we want to see. So what's next? We have our 10-year health plan, and we are working to it. As a result of the progress we've made so far, we can confidently say the NHS is on the road to recovery, but I know better than anyone that in order to be where we want to be by the general election, we need to gather speed and build more momentum. I'm determined to build the NHS around patients and to give patients the same ease and convenience, choice and control that we enjoy in so many other aspects of our lives. We're already making it easier for patients to choose and book appointments. Because of the new improvements and features we've added to the NHS app, it now has more registered users in England than Netflix. I'm not sure it says joyful, but we'll get there. 330 million messages were sent through the NHS app from GPs, hospitals and screening services to patients last year, twice as many as the previous year. AI will transform healthcare more than any other sector or industry, and with it, the potential to improve productivity. Whether that's speeding up diagnostics and medical imaging, freeing clinicians from tedious paperwork, or transforming the NHS app into a doctor in your pocket. We'll shortly set out the big leaps we're proposing on tech to improve patient care, staff experience, and NHS efficiency. And over the next year, I'm also going to enlist patients in my drive for a better quality service. We're going to trial new patient power payments. Patients will be able to decide whether the NHS provider deserves full payment for the service they received based on the quality of their experience. And where better to start than with a group of patients who have been made to feel like second-class citizens whose voices don't matter? Women. In our Women's Health Strategy, which we'll publish shortly, I'll be giving women the power to kick medical misogyny where it hurts, the bank balance. Patient choice will also help me to drive further productivity gains. Over the next year, we'll let patients decide if and when to have a follow-up appointment. And I must confess to a little bit of policy by anecdote. I have lost count of the number of times I've been invited to a totally pointless follow-up that wastes my time and NHS money. And it's not just me. We could free up millions of appointments for patients who actually need and want them. So from April, that's what we'll do. And as the Prime Minister announced in his speech in Liverpool, NHS Online will launch next year with the aim of delivering 8.5 million appointments in its first 3 years. That's around 4 times more than the average NHS trust. For patients, that means seeing a specialist for conditions including prostate cancer, cataracts, and endometriosis without leaving home. Power to the patient will also be joined by freedom to the front line. It really isn't lost on me that so many of the performance improvements and productivity gains we've seen have been driven by expert clinicians supported by trusting leaders who encourage innovation and give staff the freedom to do things differently based on their experience and expertise. I said we'd reinvent the NHS as a neighbourhood health service as much as a national health service. Tomorrow we'll be announcing the first wave of neighbourhood health centres that will deliver more services in the community, close to your home and increasingly in the home, reducing hospital admissions, getting people the right care in the right place at the right time, which is better for patients and better value for taxpayers. We're about to embark on major reform of the GP contract, working in partnership with the BMA's GP committee and others to deliver our shared ambition to make primary care providers the leaders of neighbourhood health. In secondary care, we're taking the best to the rest. We'll stop funding ineffective treatment pathways, starting with the 10 most common specialties that see the most patients and too often waste the most time and money as a result. Through new advanced foundation trusts, we'll give the best leaders in the best trusts more freedom and more flexibility, including the financial freedom to retain surpluses to reinvest them and to borrow for capital investment. We're assessing 8 candidates now. Throughout this year, we'll assess even more. By the end of this Parliament, this will become the norm rather than the exception, and by the end of our 10-year plan, every provider will be an advanced foundation trust. We're also going to trial new ways of integrating health and social care in a place-based way. And I mean health, not just the NHS. Andy Burnham and Oliver Coppard are 2 mayors who've placed public health at the heart of their mayoral agendas. They have more influence over what determines health in their regions as mayors than I do as their health secretary. Frankly, and obviously, Andy knows Greater Manchester and Oliver knows South Yorkshire better than wonks in Whitehall. And their theory of change is that if they had more levers and more control, they'd spend money more wisely and deliver better health outcomes across their regions. So we're going to put that to the test with 2 new health devolution deals. The new chairs of their ICBs will, in effect, become like deputy mayors for health. They will work with me, Andy, and Oliver to continue to drive improvements to health system performance, but their mayors will take responsibility for driving improvements to health and care from cradle to grave, and testing whether this model would be more effective at driving the shifts from hospital to community, from sickness to prevention, than the conventional NHS model. The conventional NHS model will be changing too. We'll be designing the first wave of integrated health organisations that will hold the health budget for the entire population and will be responsible for the provision of all health services for that population. This will be the most radical reform in the history of the NHS, not just because it's a complete correction to the centralised model of 1948, but because those who hold the purse strings on prevention rarely see the benefits from the results. And so there's little incentive for NHS providers to reduce the number of patients coming through their doors for treatment. Under this model, all of the incentives are in favour of prevention rather than cure. Now, it remains to be seen whether it's the mayors or the NHS managers who will prove more effective in tackling health inequalities. We'll test and learn from both approaches. And I appreciate that advanced foundation trusts, integrated health organisations, and financial flows and incentives are the sort of technocratic change that will be utterly useless to me on my local election leaflets in May, and quite tedious and technocratic for some of our viewers to follow, but I can at least enjoy a nice warm feeling inside, knowing that we'll be spending taxpayers' money more wisely and creating a healthier nation in the process. Because sometimes the most effective change doesn't lend itself to a leaflet, but better care for patients and an NHS fit for the future do. You may have noticed throughout this speech, I haven't really talked about our political opponents. That's a deliberate choice. There are elections in May, and I'll get stuck into them on the campaign trail. But when I was in opposition, I had to fight for the microphone every day and was lucky if I got a look in. Today, in government, we start every day, not just with the microphone, but even more importantly, the power to put our politics and values into practice. I know our political opponents want us to fail. Some of them don't even believe in the NHS. And I know how I want to be judged. I know how this government will be judged. Did we leave our country in a better place than we found it? At its best, politics is not a game, it's not a performance, it's not a contest of who can shout the loudest or divide the deepest. At its best, politics is how we come together to solve problems that we cannot solve alone. It is how a generation decided in 1948 that healthcare should be a right, not a privilege. It is how a nation says that opportunity should depend on not on where you're born, but on how far your talents and efforts can take you. It is how we, a country made up of people with different stories, different backgrounds, and different struggles, but shared hopes and aspirations, can write a shared future together. And if they could build a national health service with the challenges of 1948, then we can rebuild our national health service with the challenges of today. But it requires something from all of us. Yes, it requires leaders who are honest about the challenges we face and are bold enough to meet them, but it also requires belief. Belief that we are stronger together than we are apart. Belief that progress is still possible. Belief that the future is not something that just happens to us, it is something that is shaped by us. That is what we mean when we talk about change we can believe in. Not easy change, not overnight change, but real change. The kind that comes from hard work, shared purpose, and a refusal to give up on the NHS or on each other. This is the change we are beginning to see. So when people say politics cannot do big things anymore, we will point them to the patients who has been treated sooner, the diagnosis that came earlier, the ambulance that arrived faster, the life that has been saved. That is what politics can do. Not in theory, not in rhetoric, in reality. This is the change we believe in. This is the change we are building together. Thank you very much.
Take the podium now. Thank you. Thank you. Thank you so much for that. You've given us a lot to reflect on and a lot of hope as well, so thank you. Our Secretary of State has agreed to take a few questions, and I'm going to pick on a few people first of all. Do we have Laura from Sky here? Laura.
Laura Bundock from Sky News, Secretary of State. East Kent Trust, one of the trusts at the bottom of your league table, failed to report its first meningitis case for 2 days. We've spoken to the mother of one of the meningitis patients who is furious about this. She told me this morning, you have blood on your hands. Why didn't you act sooner, and what would you say to that young patient and her family?
This is a really important question. Let me just give you an account of what happened as we understand it. On Wednesday evening, a patient presented unwell. By the next Thursday morning, around mid-morning, staff suspected meningitis. At that point, they had a duty to notify the UK Health Security Agency within 24 hours. They notified them within 26 hours. That is not acceptable, and it is not good enough. I think the reassurance I can offer is that this doesn't appear to have had a material impact on the steps we took to contain the outbreak. We will obviously look more into what went wrong, why, and I'm expecting an account of that failure, not just to the UK Health Security Agency, but to me as the Health and Social Care Secretary. I would just also reassure people that what we've seen in last couple of weeks has also been a remarkable response from the UK Health Security Agency, from NHS staff, from university, school and college leaders who've had to contend with this outbreak. We saw the rapid stand-up of contact tracing, the rapid stand-up of antibiotics distribution, the rapid stand-up of a vaccination programme, and we've continued to follow the evidence and take swift and necessary action in an attempt to contain the outbreak. So far, the results are encouraging. We're beginning to see the numbers of known, confirmed, suspected cases fall day by day. We're not out of the woods yet. We would expect to see over the coming weeks cases emerge in other parts of the country. We would expect to see that in any normal year. In every case, we do lab testing to see if it's linked back to the Canterbury outbreak. We want to be sure, to assure ourselves and to assure the public that we've contained this. So we're not out of the woods. I do take failures in performance, particularly on safety, really seriously, and we will give an account of this. I do also want to commend the brilliant work of frontline NHS staff, university, school and college staff and leaders, and the students themselves for the way they've come forward and stood up the response to what has been a really awful situation. This is, for all of the treatment we have available and the vaccination, this is a high-risk and deadly disease. And throughout the last week, I've had at the forefront of my mind the 2 young people and their grieving families and friends who have been lost as a result of this meningitis outbreak. That is why we take it so seriously.
Thank you. Catherine, GB News.
Thank you. Catherine Forster, GB News. Wes Streeting, you are Health and Social Care Secretary. Social care still in crisis. Many NHS beds being taken up by elderly people desperate to go home, but who can't because the care packages are not in place. You've ordered a review. Successive governments have done this. What do you say to people that think that yet again social care has been kicked into the long grass by this government and that elderly people are not a priority? Thank you.
So we've done some big and important things since we came to office on social care. The investment matters, and as I mentioned in my speech, over £4 billion being invested into social care. But we've also delivered the biggest expansion of the carers allowance since the 1970s. We've invested more and consistently into the Disabled Facilities Grant, which is more home adaptations, which isn't just more ramps and handrails, accessible kitchens and bathrooms. This is dignity, independence, quality of life given back to people who are either older and or disabled. So those are important changes. What we're doing in terms of fair pay agreements, the first of their kind in any sector in this country, will help us to tackle the recruitment and retention challenge we have in social care. And backed by £500 million of investment, this is a first step and part of building the care workforce into what I believe they should have always been regarded as, which is a care profession. These are skilled and dedicated people, and we are investing in them, their futures, and their career progression. What we're also seeing, in a way that doesn't necessarily lend itself to headlines, but is extremely important on a practical level, is better interaction between the NHS and social care, between the NHS and local authorities. And if I think about the experience we've just had this winter compared to the first winter I experienced as Health and Social Care Secretary, those interactions, particularly to tackle delayed discharges and admission avoidance, have been better. So on an operational level, that really matters. I know there's much more to do. The reason I commissioned Louise Casey to do the commission that she is leading is because she is one of Whitehall's best known doers. She cares deeply about this issue personally and has lived experience and has her family and other families in her mind's eye as she's doing it. The first report we're expecting this year that will set out some immediate actions we can take during this Parliament. And the longer term report she publishes will, I think, do something that so far has eluded us in politics, which is to build a national consensus about what the future of social care should look like. Because if I think about the NHS's experience since 1948, yes, the Tories voted against it 22 times when we were setting it up as a Labour government, but ultimately we built something that has lasted, and ultimately, through some ups and downs and different policy choices, some wiser than others, broadly we've agreed in this country about healthcare that is free at the point of use, owned by us to be there for all of us. We want to build that same sort of consensus around what social care needs to look like, how it should be funded, so that on those big questions, there is consistency from one type of government to another. I hope we can build that consensus. I've actually been really encouraged by what I've heard from my counterparts in other political parties, even as that's slightly less true now on the NHS, ironically. But if we don't approach this with a view to building a national consensus, we will become yet another government that is cursed for inaction and a poor legacy on social care, and I do not want to be the social care secretary that allowed that to happen.
Thank you. Ella from the Press Association.
Hello, you've covered some of what I was going to ask about the meningitis outbreak. Is it something that, I know you've asked the UK, the JCVI to look into this. How quickly are they going to look into it, and when have you asked them to report back to you by?
So the JCVI, the Joint Committee on Vaccination and Immunisation, it is an independent committee of experts who advise governments on vaccination programmes, who should be vaccinated, for what type of disease, and at what time and on what scale. And the reason we take an evidence-based approach to this is you have to weigh the upsides as well as some of the risks, and you have to think about effectiveness and cost effectiveness. This is why these are scientifically led decisions. Given what we'd seen in the early days of the Canterbury outbreak, which was a scale of and a pace of infection, I wanted to ask the JCVI proactively to give us fresh advice. They're considering that, and I look forward to hearing from them, for them to advise me in a timely way, but we'll obviously act on the advice they give us.
Thank you. Dennis at The Guardian.
Over there. Just over there. You need to put your hand up, Dennis. Not everyone knows and loves you as much as I do.
Secretary of State, today's British Social Attitude Survey that you referenced earlier do show indeed the first rise in public satisfaction with the NHS for 7 years. They also show deep enduring public frustration with access to key NHS care, as indeed, again, you referenced. Given that enduring public frustration, which of the key NHS access targets, waiting time targets, can you today commit that this government will meet by 2029? Just the 18-week hospital treatment target that you've talked about before, or also the 4-RNE target, the cancer treatment target within 31 and 62 days, and also ambulance response times within 8 and 18 minutes? Thank you.
Thank you, Dennis. For those who couldn't hear at the back, the question was about what targets do we expect to hit by the end of this Parliament. As this social attitude survey shows, and regular opinion polling shows, the public expect high quality and consistent access to the NHS where they need it, when they need it. And we put up in lights our commitment to get to 18-week waiting times for elective planned care by the end of this Parliament. We can hit that target. I believe we will hit that target. Our plan to do so has always been predicated on, firstly, turning the tide, because it's the first time in 15 years we've been seeing waiting lists consistently falling. Secondly, to get the NHS moving in the right direction, to cut those waiting times. And thirdly, through not just the investment we're putting in, but through the modernisation, to pick up the pace. So I totally understand why when people look at the waiting list size compared to when we came to office, people might look at how much progress we've made in 20 months and say, well, if you did that all over again in the next 20 months, you're never going to hit that target on time. That is obviously true, but our plan isn't based on maintaining the pace we've built up. It's about building momentum over time. However, I know if I go into the next general election saying we've hit the waiting time standard, we've taken it from 18 months to 18 weeks, but there are still queues of ambulances outside hospitals, there are still trolleys on corridors, and other people aren't getting cancer diagnoses and treatment on time, I'm not going to be greeted on the doorstep by overwhelming praise and a grateful British public. People will be saying, oh, it's all very well you're sorting out those waiting times, but what are you doing about the rest of it? So what we're striving to do, what we're showing signs of already, and what I believe we will be able to show by the next general election, is that the NHS is far better then than it was when Labour came to office. I'm going hell for leather to try and get the NHS back to all of the performance standards it should have met. Can I guarantee we're going to get there on all of those performance metrics by the next general election? No. But am I going to give it a good go? Absolutely.
Thank you. I've got a question here at the front.
Mic coming.
Hi, Rebecca Thomas, Health Editor for The Independent. We've had the results of the British Social Attitude Survey, and you said the NHS is in a better place now than when you came into post. Following rumours of a reshuffle, do you think your job is safe now?
That is for the Prime Minister to decide. As I said in my speech, lots done, lots more to do, and I'm just getting started.
Thank you. Ellie from The Times. Ellie, please put your hand up. Thank you.
Hi. You spoke about us being in a dangerous place for democracy. Do you think both Reform and the Greens are fueling that cynicism? And where do you think this Labour government have got it wrong in terms of tackling the pessimism that you talk about so far?
I think the danger of populists to our left and to our right is the politics of slogans and easy answers. In terms of what we're seeing from the Greens, this is not an unusual or unexpected phenomenon. In fact, if I think back to the last Labour government, the role the Greens are currently providing of being critics to our left, asking us to go further, be bolder, be more radical, was effectively where the Liberal Democrats positioned them at under the last Labour government, which is why the Lib Dems are currently struggling in the polls, because they haven't quite yet found their feet and their unique selling point in this political terrain. And so the Greens are positioning themselves as the as the sort of the challenge to our left, of a type we've seen before under previous Labour governments. And the most important thing we can do to take on the Greens is to show that we are delivering the change that people voted for, and change that people can believe in because they are feeling it and experiencing it. At the same time, we should also take on the Greens as we would any other political opponents. So when you've got a leader who claimed that he could do breast enlargement via hypnotherapy, I think there are legitimate questions to answer about why such a person should be trusted with elected office and position himself as someone who could run the country. And you know, there are other areas of green policy where I think we should take them on and do so in the way we would any other political opponents. Reform are a very different type of beast and a very different kind of threat. For all of the differences we have with the Conservatives, and there are many, including their abysmal record of failure with the NHS, Reform are threatening to dismantle it. Nigel Farage says he wants an insurance-based system. He says when it comes to the future of the NHS, he's up for anything, and I believe him. Reform now run like a mile away from things they've said on this, because they know that they don't believe in the NHS. They don't believe in an NHS that is owned by us to be there for all of us. They don't believe in an NHS that means that whenever you fall ill, you never have to worry about the bill. But the British people do. And we have got to expose that, because I think in the run-up to this May's election, there are still lots of people in this country who are considering reform, but if they knew what Nigel Farage really thinks about the NHS and its future, they wouldn't touch reform with a barge pole. I think particularly of Wales. This is the country that built the NHS, gave birth to Bevan and birth to the National Health Service we have today. The idea that the country of the NHS and of Bevan would elect reform to dismantle it, it sends shivers down my spine. So we have got to take reform on the NHS. Finally, and I feel this very strongly, sat in this part of London, having grown up in East London and thinking very movingly about what I saw in Golders Green on Monday and the conversations I've had with Jewish and Muslim and Black and Asian constituents in recent months, we are seeing a tide of racism in this country, and a type of racism that I have never seen before as someone who was born in the 80s. It's the type of open, unapologetic racism I heard described to me as a kid from the 1970s. It is back. Reform fuel it, their politics benefit from it. And this is a completely different type of threat to who we are and what we stand for. They have the audacity to dress up nationalism as patriotism and claim that they are the party for the working man and woman. At the same time, they are an affront to this country, its history, its heritage, its values, and its National Health Service. So yes, reform are a very different threat. I think they're an existential threat to this country, who we are and what we stand for. And if we can't defeat this lot, then we shouldn't be in the business of politics at all. We're going to take them on and we're going to beat them.
Thank you. Nick from HSJ.
Hi, Wes. Nick Katuna from the Health Service Journal. The British Social Attitude Survey, we've discussed it already about the turning confidence in the NHS, but the recent staff survey showed significant drops in staff engagement and morale, and even some of the surveys for NHS England and Department of Health and Social Care showed some pretty significant drops as well. I mean, there was only 3% of NHS England staff thought that change was being managed well, and similarly, only a handful of people, a smaller proportion of people thought that senior leaders had a clear vision for the future in the DH. So what do you say to that in the context of the social attitudes having improved, public satisfaction improved, yet despite that, staff surveys show some pretty significant drops? And just one more, the dispute with resident doctors is still ongoing. Does that, if there's to be a deal to be made, does that mean that any further money that might go to them would mean less for other staff groups?
Okay, so two things. Firstly, I take staff satisfaction and experience surveys seriously, because when we talk about the NHS and the service, we're not talking in abstract, we're talking about people, the people who deliver it. If you haven't got the people, you haven't got the service. The only way in which we're going to drive improvement is by mobilising that team of 1.5 million people who work in the NHS to deliver the service. And they have been through hell and back during the pandemic, and working in an NHS that was failing before the pandemic and trying their best to pick up the pieces after the pandemic. So we owe it to staff to give them the experience of working in and delivering and improving NHS. I think we're doing that overall. To my own department and NHS England, we are currently merging both organisations and halving them in size. It's one of the biggest currently voluntary redundancy programmes we've seen in the history of the public sector. Thousands of people are leaving the organisation. Am I surprised, as we've been doing that people are unhappy and that this has been a not pleasant experience? No. Am I indifferent to it? Absolutely not. Do I think it is the right thing to do? Certainly. I wouldn't put people through it if I didn't think that it was worth it to free up £1 billion to invest in frontline services and to tackle something that everyone from patients to frontline staff know to be true, which is there are and have been, through no fault of the staff working in those organisations, far too many layers of bureaucracy, far too many checking functions and not enough doing functions, and far too much duplication. And if you're on the receiving end of it, as an NHS frontline leader or manager or frontline staff member, it drives you potty and it holds you back. So we're doing it for the right reasons. Change is hard, and it's hard on people, and that's not lost on me. But I think it's the right thing to do, and I think the impact it will have on the health service will justify what it is that we're undertaking.
We've got time for two quick more questions. I'm actually going to go to Estella, a UEL nursing student first, and then I'm going to finish off with our colleague there. So let's go to Estella first.
My name is Estella. I'm a third-year student here at UEL. What's your advice for newly qualified nurses and midwives about job opportunities? As we are aware, there is currently a freeze in recruitment.
Yeah, firstly, I'm really glad you're here. We need you. And we, I think, have an obligation to students coming through, not just the doctors, but nurses, midwives, allied health professionals. You are offered opportunities to take these courses up, to commit to training, investing in your own future as you are doing so, with the promise and expectation that at the end of it, you'll have the chance to serve in our National Health Service. And if you meet the standard and make the grade, that is a reasonable expectation for you to have. Unfortunately, what we've seen in recent years is absolutely atrocious workforce planning. So we've had this absurd situation where we don't have enough nurses and midwives, and we've got people qualifying who could help make the difference, and we have other jobs available for people to go to. And, I'm not knocking other professions and other jobs that people are working in, in other sectors, but you don't go through all that time, trouble and effort and building that experience and expertise to go and work in retail or in an office environment. And that's what's happening. So I definitely feel a duty and a responsibility to you. We've worked with the Royal College of Nursing, Royal College of Midwives, Unison and others to start building some guarantees. And we've got our workforce plan coming soon so that we can give future students that confidence of knowing that with the places that are available on these courses, there will be jobs waiting at the end. And we're also working to make sure those opportunities are felt throughout the country as well, so that it's not just in big cities where we're driving new jobs and improvement, but right across the country. And, you know, I do feel we owe a literal debt to your generation to get this right. And I feel that pressure on my shoulders not to let you down.
Thank you. Final question is our colleague here.
Good morning, Secretary of State. Dominique Allwood, Chief Executive of Health Innovation Network. Thanks for your comments. I just want to draw you back to the world of transforming the NHS. And you talked about some of the challenges being both structural and cultural. From a Health Innovation Network perspective, we see those barriers not being a lack of ideas or solutions, but often that frontline teams don't have time, permission, incentives to think differently. And indeed, we talk about that in our report, thinking differently. So my question to you is, what needs to happen to shift culture so that innovation is something that's a default way of doing improvement and transformation of care, rather than something on the side that people just don't have time for?
So firstly, we need to value change management functions. This is a really dull technocratic answer in the first part to your question. It's a sort of thing that people occasionally chuck FOIs in about, and I'm having to account all these managers for and why we've got all these non-clinical roles. But if you're rolling out something like a new patient record system or a new piece of kit for clinicians, or something that your admin team can use so that they're spending more time on the things that they enjoy, which is interacting with patients, and less time on trying to manually transfer from one spreadsheet or record or system to another. That is a change process, and people need to be supported and trained through that. And when you're rolling something out like that, you need to make sure it's done in a planned way. Where that hasn't happened, we've seen the disruption, and nothing makes people in the NHS workforce shudder more, in my experience, than we have a new IT system coming for you. People think, oh no, not again. Will this one work? And if you've got the right training and support capacity, yes, it will. The other thing is, and I'll be honest, this is where the NHS has cured me of some of my cynicism. If I think back to when I became Shadow Health Secretary in opposition, my own perception of the NHS was of a service that was resistant to change, would recoil from a politician saying we need modernisation, we're going to do reform, although I've replaced reform with modernisation for obvious political reasons. I found the opposite. People are crying out for change in the NHS. The people who are working in it every day are the people who see it as best and see it as worst. The people who complain most about pointless bureaucracy are the real victims of it, which are the people who are tied up in it, the staff that are having to kind of think, well, why am I doing this check? Well, why am I? So I've actually found people are really up for it. That is about changing the way that we do things, in the way that the NHS has always done it its best, but also embracing the new technology, the AI, the machine learning, the big data, the life sciences, the med tech. There is so much of it, and this country is a science superpower. You know, I'm just going to end on this optimistic note because it's very easy to be depressed about the state of the world at the moment. Think about how small, actually, this little island is. When it comes to science and technology, we are up there with the United States and China in the league of science superpowers. And so much of what we do is around health. It's the most exciting part of this revolution. If you look at us per capita, per head of population, we're not third in the world, we're number one. That is an amazing place to be. And we're better to celebrate that and recommit to it than sat here in a university which is, yes, generating research, innovation and ideas, but not just in theory, engaged in practice. Look at what UEL is doing, putting innovation to work. Look at what UEL is doing, delivering and pioneering neighbourhood health. It's a really exciting place to be. So for all of the challenges we've got, and believe me, there are many, for all of the pressures that NHS staff and leaders here today feel, and believe me, I feel it with you, there is lots of grounds for optimism, lots of reasons to hope, and so many reasons believe, and I genuinely think that when we look back on our time, we will be able to say, because of the work we're doing together, that we were the generation that took the NHS from the worst crisis in its history, got it back on its feet, and made it fit for the future. And I don't know about you, but I can't think of anything else I would rather be doing with my life. Thank you very much.
Minister, thank you. Thank you so much for your time. What a fantastic ending of this session this morning, and for your openness to the discussions as well. Thank you, colleagues, for joining us this morning. And I think you've left us all with a huge amount of hope.
And I won't test you on integrated health organisations and advanced care providers and all of the other acronyms, but we'll do that another time. But thank you for coming along. It's been good to talk to you.